Hi, this is Dr. Good, Dr. Simon Good, with the new free mini course intro. Hope you enjoy it. This is Dr. Good. Many people suspect that they have a hormone problem, but they remain unsure. Hormones control many facets of our metabolism, from puberty to passing. Whether we're 15 or 40, the start of our reproductive life, or approaching the end of our reproductive life. Maybe we're 35 and stressed, running a family, children, a business, possibly a husband. If you take the contraceptive pill, or maybe you already reached menopause. If you suffer from exercise and diet-resistant weight gain, especially around the abdomen, PMS, anxiety, tears, moods, depressed. If you've got irregular periods, or heavy periods, or breast tenderness, headaches, foggy thinking, impaired libido, reduced sex response, then you've got the classic symptoms of estrogen dominance. Really, it's known as progesterone deficiency, where there's a relative excess of estrogen, but little or no progesterone is being produced at ovulation in an amount necessary to balance and neutralize the growth and irritant properties of the estrogen present. Now, I'm not recommending the use of estrogen supplementation or synthetic estrogen HRT, rather the opposite. I recommend restoring our progesterone levels, our natural progesterone levels, as needed, with a specific amount of progesterone, a tailored, individualized amount of bioidentical progesterone, necessary to restore the natural hormone balance between estrogen and progesterone. Explore this site, Dr. Good, Sex, Hormone, Health and Happiness. Learn more about hormone balance. Understand why you and your loved ones may be suffering. Today we're going to focus on normal female sex hormones and their function. Women have three primary sex hormones: estrogen, often thought of as a female hormone, but men also make it. 2, progesterone, the hormone of ovulation and early pregnancy. And 3, testosterone, often thought of as a male hormone, although it's a crucial hormone in women as well. Testosterone is the hormone that provides energy and zip and drive, clarity of thought, weight control, good sex function, healthy bones, and keeps us out of a nursing home. Normal sex function is all about balance. When a woman's going well, the estrogen that she makes from her fat and eggs is balanced or opposed by the progesterone that she makes when she ovulates correctly. She's got normal fat, normal breasts, normal periods, and is not irritable or anxious. To consider this balance, we need to think about a children's playground type seesaw, with estrogen on the left, balanced by progesterone on the right. So if we're going to understand more about the importance of this balance, we really need to appreciate just where these hormones are made. Now, the estrogen that sits on the left-hand side of the seesaw is only made in 2 places in a female. 1, egg follicles, the cling wrap-like linings that surround egg follicles in young ovaries. It's called ovarian granulosa. And 2, fat cells, adipose tissue. And we've all got enough of that. Women usually deplete their ovarian egg reserve during their 40s, during which time things start to change. Although she continues to have periods, they're changing. They may be heavier or intermittent or too frequent. When a woman's egg follicles have disappeared, she can no longer make any more progesterone. She can make estrogen from her fat cells because that's still there, the eggs have gone. But she can no longer make any balancing progesterone. If she's got 0 eggs, then she can't ovulate. She's got nothing to ovulate. A little bit more fat, maybe a little bit of breast fullness, breast tenderness. The periods may get heavier. Hormone balance changes in favour of estrogen. because her fat cells remain, she continues to make estrogen. Remember, estrogen is made in fat, often more than we want. And these fat cells continue to make estrogen despite of the absence of eggs. In other words, estrogen is still sitting on the left-hand side of the seesaw, but there's little or no progesterone in the system to balance it. So, estrogenic symptoms arise. So, in summary there, fat and eggs make estrogen in a young woman, which is balanced by the right amount of progesterone made at ovulation. If the balance is good, then breast, periods, fat, anxiety are not a problem. However, if insufficient progesterone is made to balance the estrogen made in fat and eggs, then the system becomes estrogenic. Stimulates growth in the womb lining, the endometrium, often resulting in heavier periods or breakthrough or clotting. It stimulates growth in breast tissue, increased size, maybe tenderness. It stimulates fat deposition in the fat cells, a bit more weight gain, overweight, and it lowers an important brain chemical called intraneuronal serotonin, tongue twister, the very cause of anxiety. Unresolved anxiety, moods, tears, depressed, the odd strangling, you know how it goes. Progesterone on the right-hand side, however, is the key, and it's only made when a woman ovulates her eggs correctly from the surface of her ovary. So in essence, the hormonal challenge for a woman in life is to make the right amount, the correct amount of progesterone when she ovulates on the right, to balance the estrogen that she's made in her fat and eggs on the left. In years gone by, Mother Nature would have said to the woman, look, we've got progesterone everywhere, we've just ovulated. We've got an egg floating free, waiting to be fertilized. I'm going to convert some of this progesterone into testosterone so that you can become super sexy and so you can fertilize these eggs and also grow some energy and muscles about yourself so you can look after these babies. As you can imagine, when a woman runs out of eggs, Mother Nature says, well, I don't need you to be fit and energetic or sexy if you don't have any eggs. If there are no eggs left to fertilize, then there are no babies to look after. If a woman can't make sufficient progesterone by herself when she ovulates, or she's run out of eggs, or will never ovulate or make any progesterone again, then a specific dose of progesterone, natural bioidentical progesterone, tailored for the individual, can be prescribed to offset the adverse effects of this unbalanced estrogen and to provide the precursor necessary to make sufficient testosterone naturally, and thus maintain energy and muscle and clarity of thought, libido, sex function, and good bones. In the next video, we will consider the effects of insufficient or no progesterone and how they cause persistent overgrowth in breast tissue, endometrial cells, increased fat, obesity, type 2 diabetes, which can progress into uncontrolled growth, and endometriosis and fibroid formation, endometrial cancer, even breast cancer, and yes, even fat cancer. We call it obesity. You don't need to go down that path. Thanks for listening to Dr. Good in Sex, Hormones, Health and Happiness. Andropause, strange name. As men reach 40, there is a progressive loss of testosterone production and a rising level of estrogen production. If you're a man with increasing abdominal fat or breast development, increasing intolerance or a short fuse, or just grumpy, anxious and depressed, if you suffer from erection difficulties or reduced sex drive, or you need to pass water several times a night, or there's difficulty with the urine flow or with prostate problems, then this is classic andropause, the problem of falling testosterone and a rising estrogen. It affects most men as they age. The problem that makes men look and feel older than they really are. Make a decision. Learn more about andropause. Decide to do something about reducing the risks of obesity or type 2 diabetes and prostate disease. Take charge of your life and live to your potential. This is Dr. Good for Sex Hormones, Health and Happiness. Women can be given specific amounts of natural progesterone, the very molecule that Mother Nature once made, the one she would make if she could make, in just the right amount to balance out the seesaw, to oppose the adverse effects of her fat-made estrogen and her estrogen-like exposures. The dosage must be tailored to the individual woman's needs and blood tests. There's no such thing as one dose fits all, like HRT or penicillin. We're all different. Different shapes, different sizes, different symptoms, different needs, different blood tests. So the dosage must be individualised. Imagine your favourite dress shop with only one type of dress or one type of blouse for sale. All the same colour, all the same size, all the same shape. Look, the one size fits all policy doesn't hold water anymore. If you're a health professional, such as a naturopath or a health coach, a pharmacist, osteopath or an interested GP, caring for women with sex hormone problems, or maybe you've got friends and loved ones who are troubled by increasing abdominal fat, breast symptoms, heavy periods, anxiety, moods, lack of energy and so on, and you want to help, then you can learn more about how to correct these disorders safely and naturally using the correct amount of bio-identical natural hormones. Discover what every doctor should know about sex hormones and menopause. Become the go-to name and build your business with more active learning in the Dr. Good series. We look forward to seeing more of you.